Let's talk some sports medicine right now. Bring in our good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Dr. Joe, where do you want to start today?
Hey, Ray, how are you today?
I'm doing terrific.
Great. I got topics I want to just touch on a little bit. The first one is, could go under the title of, the mega stars defy the odds. LeBron and Tiger Woods, their careers have intertwined to some extent, and before our eyes, we've seen these mega stars do a lot of things on the course and on the court. And one of them is defy the odds of injury. And LeBron out there, and he is doing very well in the playoffs, despite the fact that a couple of foot and ankle surgeons really thought with this injury he had that he really needed to have surgery done. That was their recommendation. He would have been done for the year, and here he is playing out the playoffs. But in the meantime, a couple weeks ago, we saw a view that was it was kind of hard to watch, and that was Tiger Woods as he had to withdraw from the Masters. And it probably was about the worst scenario it could be at the Masters, really cold and rainy. They had to play 2 rounds in a day, and everybody knows it's such a very hilly course, though he loves that course. And here he is out there competing with the greatest athletes, greatest golfers, these young golfers, despite a crush injury that he had in February of 2021. We talked about on this show and on many, many shows around that many people thought that was going to be the end of his career, but he came back and he played in tournaments and a few majors. And but this was really hard to watch as he limped around in his final round there and had to withdraw. And now the word, of course, shortly after the Masters was that he was going to have a surgery. And a lot of people really scratching their head about what is this subtalar fusion surgery that he's having. This is a surgery that we do as kind of a salvage surgery, kind of a last resort in people, a lot of times in adults. It's where 2 bones are connected by a screw or a pin to get rid of any of the bones rubbing together or arthritis or pain. So it stabilizes the joint, and we use it in several joints in the body, stabilizes, and it reduces the pain from arthritis. But obviously what you give up on the other side is you give up range of motion. And so that talus bone that sits between the ankle and the heel bone, you fuse those bones together, and you're not going to have nearly as much motion up and down and rotation of the ankle. That's where the motion comes from. And so with that surgery, it's a long time. It's probably going to be in the range of 6 to 8 months before he can even start physical therapy. He's a physical therapy wonder, and he, again, survived getting back from the injury in February of 2021, but he wouldn't even be involved in rehab until probably 2024. And so people looking at him playing again. But I did read one interesting, I looked at several pieces. One interesting foot surgeon said that he will now have much, much less pain in the ankle, and that may be an advantage for him when he attempts coming back again in 2024. As he said, he'd like to try to come back from this again. But it would be monumental, but these guys have done it before. But a fusion surgery is done, and it connects the bones together. It helps get rid of the pain from arthritis, but restricts the range of motion, which would be really tough for a golfer who has to be able to make all the shots and hit the ball far and rotate at that foot, I would imagine, to some extent, for sure. So we'll keep an eye on Tiger Woods. He always seems to kind of find a way to bounce back as he rehabs next fall and probably into 2024. The other thing I wanted to ask you is you keep an eye on just about everything, and I don't know if you saw this, but I have spotters out there that give me calls and say, hey, did you see this new sports medicine thing? And I didn't catch it. I'm not watching much XFL football, but did you see the concussion kickoff rules in the XFL, Ray?
I did not. Tell me about them.
But what they're doing is they are having the kicker kick from the 30-yard line, so they're not going to be kicking it out of the end zone as much. But the 2 teams line up at the 30 and 35-yard line, only 5 yards apart, so that there's only a 5-yard zone of contact. And they can't move between the 30 and 35 until the the kick returner catches the ball and starts to run. And so there's only 5 yards of them hitting each other rather than 35, 40 yards of the length of the whole field. And the returner then has to return through a line in the 30-35 where there is contact going on with players, but only with the 5-yard zone. And so the injury, the play that is the most injury-prone in the game of football, trying to come up with new rules to try to reduce concussions in the kickoff but not take it out of the game totally, is what are called concussion kickoff rules in the XFL. And I just wanted to mention that one almost got by me, and I did not see that. So we'll keep an eye on that and see how it plays out.
I like that idea, Joe. You've often said those players sprinting down at that weight and that strength and that speed and then collisions, you're setting yourself up for injuries and such. I like the idea. It's almost just like another play from scrimmage, only with a big kick. I like it.
It really is, and only 5 yards. So I watched one or two of the kickoffs. You cannot generate nearly as much of the energy that you do. So you're right about that. But we'll have to see how that plays out, and if it maybe the XFL can act as kind of a lab for us in different sports as they kind of change sports and try to play with different things and change the rules a little bit. Maybe we'll learn a few things from the XFL.
There you go. Dr. Joe Congini joins us Wednesdays at this time here on the Ray Horner Morning Show. Joe, as always, thanks for making time for us this morning. We appreciate it.
All right, keep an eye on Tiger Woods, and we'll have thoughts still of him in our memories. He's quite an incredible player. I'm not saying he's done yet because these megastars have defied the odds before.
You're exactly right. Thanks, Joe. And when you talk about memories of Tiger Woods, man, how about him at Firestone South Course? So many great memories of Tiger winning the tournament, hitting it with car headlights, giving him a view to the green and everything else. He did it all here at Firestone South Course.